Once upon a time, healthcare was simple. There were the people and the doctors. When the people got sick, they paid the doctors to make them better. Sometimes in money, sometimes in whiskey or tomatoes or whatever. When the people couldn't pay, the doctors might help them anyway, and it didn't really matter because the doctors didn't do much that the people couldn't already do for themselves. But then the doctors discovered real treatments and cures for terrible diseases like tuberculosis and polio, and the doctors turned into the hospitals. Now the people would pay their last dollar to get into the hospitals, but it was expensive. So the people created the insurance companies, where many paid into a pool to cover the few who got sick. And it seemed like the perfect idea, until a few mischievous hospitals realized that they could raise prices and that the people wouldn't notice because the insurance companies were paying. And the insurance companies realized they could raise rates and that the people wouldn't notice because usually their employers were paying. And there was another problem. Insurance companies didn't want to cover seniors because they used a lot of services and didn't have a lot of money. So in 1965, the people created Medicare. Medicare was big enough to tell the hospitals it wasn't going to pay their huge bills, and it paid them standard and fair prices instead. But for everyone else, prices rose, and profits soared. And the hospitals and the insurance companies and the drug companies pocketed trillions of dollars. And it only got worse and worse. Every year, the hospitals discovered thousands of new ways to raise prices. A whole new industry of consultants emerged to help and made sure nearly all the hospitals were doing it. The hospitals that caught on fast bought up the slower or more honest hospitals. And the same thing happened with insurance companies, until most cities only had one or two major hospitals and insurance companies. And then they were free to raise prices, even faster, and there was nothing anyone could do about it. Except Medicare, which was big enough to keep on paying its standard fair prices. Eventually, some people started to ask the government, why can't we all just have Medicare? But the government couldn't imagine doing that, because through this whole story without anyone noticing, the companies had been spending hundreds of billions of dollars per year on gifts to become special friends with the government. And so, instead of allowing Medicare for all, the government came up with a different idea and tried to sell it to both the people and its special friends, the companies. Their idea was to pass a law that would force all of the people to buy insurance from the insurance companies. The government would pitch in for people who couldn't afford to pay. The people thought about this idea and decided it didn't really make sense. The companies thought about it and weren't sure. Everything was so perfect, just as it was. But eventually they said to their special friend, the government, as a favor to you, we will take all these hundreds of billions of dollars you want to force the people to pay us. And that is how we got the Affordable Care Act, otherwise known as Obamacare. And the hospital companies and the insurance companies and the drug companies and the government all prepared to live happily ever after, and to keep raising prices and raising taxes and watch profits soar forever and ever. But the people were not happy. Yes, technically more people were covered by insurance, and Obamacare had several other really good perks. But now more than half of insured people were plans that did not pay a cent until the people paid $5,000 or even $10,000 or $15,000 of their annual income, which for millions of people was all of their income. So more people had insurance, but fewer could afford to go to the doctor, and tens of millions of people still had no insurance at all. Medicare, on the other hand, even after Obamacare, kept on doing what it had always done, provide quality, no-hassle care, while keeping America's healthcare costs under control. And so finally, a strong nationwide movement began to rise all across America, with liberals, independents, and even more conservatives finally uniting behind the obvious solution of Medicare for all. Today, more and more members of Congress are breaking with the companies to publicly support Medicare for all, and even President Trump ran on a campaign promise of universal health care, which sounded a whole lot like Medicare for all. How this story ends depends on you, because though the companies may spend billions of dollars on our politicians, only you have the power to vote them out of office.